Megan from Aspire Health and Rehabilitation. I'm going to be showing you a rock tape or K-taping technique for the lumbar spine. Now, rock tape or K-tape is a tape that you can use that to help provide a bit of support while moving through full range of movement. So those that have got significant initial like a lower back injury, an acute lower back injury or a disc injury, ridge tape might be the better way to go to help try and provide that really spinal alignment, structural support kind of taping. However, this kind of taping is more for when you're competing in a run, or you're doing cycling, or Olympic lifting kind of movements, or even in data activities where I help provide a little bit of postural support for you. I'm going to be doing taping demonstrations on myself just to demonstrate how you can do it on your own. However, it will require you getting into, you will have to put the area on stretch like I have shown in previous videos and applying the tape yourself. I'm going to be doing it over clothing for demonstration purposes. However, I'll explain to you a little bit more in detail. And I'll also provide a tag team approach and get the cameraman to help me out as well. And I can show you how, if you've got a partner or a friend there next to you that will be able to do this for you instead. And it might make it a lot easier, especially if you do have a little bit of pain in this movement. You can also, you can actually lean onto something like a bench or a table or a pole just to help offload the area, so you're not having to hold yourself in that position for the duration of the taping technique. Now with the tape, it can go up to 180% stretch. We don't want that. We only roughly want 50, 60, 70% stretch. So I normally start the tape just underneath the undie line, okay, and you will be taping up either side. You will be using 2 strips either side of the spine, okay, so you're going to be getting the tissue either side of the spine. So starting just underneath the undie line, and you will be going up. Remember, you will be in a bent position, so you will need to be mindful of that when you do your cutting of the tape. So bent position, you're going to be taping just underneath the undie line, and you're going to be taping up. And you can go as high as, for the girls as well, if you've got like a bra strap, you can go even as high as that. However, you don't have to go that high for taping. Okay, so I'll show you what I mean. Okay, getting a strip of tape, I normally round the edges off so it doesn't get caught on clothing and doesn't lift up. First 2-3 centimeters either side of the tape, you don't want to stretch. It provides a bit of an anchorage point, and if you actually stretch throughout the whole tape, you can actually increase the risk of things like skin irritations. Okay, so remember, feel the spine where it is. You're going to be taping either side of it, so if you're doing the tape yourself, you can get into a forward position. You can actually apply the tape first, just underneath the undie line, for example. So if I was to tape, for example, here, okay, from here, I'm going to be leaning forward. Okay, first I'll start unraveling the tape a little bit. Okay, leaning forward to put the tissue on stretch. As you take the tape up on the side of the spine, as you lift up and keep it on stretch, you're going to be taking the other hand up as well to lay it down. And again, last 2-3 centimeters won't be on stretch as well. So that's one tape. You're doing the exact same thing on the other side, okay? On the other side of the spine where the tissue is. Okay, after that, after you got your 2 straps here, you can also put like a decompression strip like I have on the other taping videos, to try and help offload the area a little bit and lift up the skin. Not absolutely necessary, but I'll show you what that looks like. With the tape, the anchorage point will be the actual spine itself. So when you actually cut the tape, okay, you actually want to, again, round the edges off. You actually want the middle of the spine to sit in the middle of the tape. So when you actually rip the tape off, you're not just going to leave it as that and peel it off like a band-aid. You actually take 2 off, and that middle point will be where the spine will sit. Okay? Again, you can do this on yourself. It is going to be a little bit hard and tricky. It is really good to have someone there next to you. Okay, so you're going to, what I normally do at the lower back, okay? So again, finding the middle of your spine, putting the tape down, okay? You can do it standing up. I normally do it in a bent position again. Again, peeling off the tape like you're peeling off a bit of a band-aid. Again, 2 or 3 centimeters of stretch, holding it down, 80% stretch to 90% stretch, and then laying off the last little bit. Again, holding that position there where the middle of the spine is. unravel it, 80-90% stretch, lay it down, and the last 2-3 centimeters won't be on the stretch. Okay, you can use the 5 centimeter tape for that decompression strip. However, you can also use, if you've got on hand, not always everyone does, is the big 10 centimeter strip to help cover that whole lower spine. Alright, so now I'm going to be showing you the partner taping technique for this exact same one for the lower back. So I'm going to bring in Hamish to help demonstrate. So he's going to be yourself, for example. I'm going to be the friend or the partner. You'll be leaning forward again. For example, you do need to put the tissue on stretch, so you will be needing to bend forward. You can hold onto a pole or a kitchen bench to try and help offload, so you don't have to actively hold that position. I'm going to be doing it over the clothing just for demonstration purposes. You'll find the spine itself, and like I said, you do want to tape either side of the spine. You start the tape just underneath the underline. Okay, anchorage point, so 2-3 centimeters anchorage point. You want to unravel the tape. Okay, again 2-3 centimeters, holding it down, and you're going to be putting the stretch on 50 to 70% of the tape up either side of the spine. 2-3 centimeters, and you'll lay it off like that. Okay, again you do the same thing on the other side, either side of the spine. Then you'll do the anchorage, the decompression strip, for example, and what it will be is essentially going across the spine like that. You can do like I said with myself, a 10 centimeter strap across here, but not everyone has that. So I'll show you what I'll be doing with the 5 centimeter. Okay, so again, you don't want to have the edges on there if they get caught. Now, it's going to be going on like that. The spine will be the center of the tape, so you will need to rip off that centrage point. So that'll be the anchor. Find the spine, applying the tape without stretch first. Okay, peeling it off. 2-3 centimeters, holding it like a band-aid, putting that part on stretch, lay that off like that, and you're doing the exact same thing on the other side. 2-3 centimeters, applying the stretch down, laying it down, and then the last 2-3 centimeters. So imagining 2 lines down here with the tape, center of the spine in the middle, okay, and then you've got the decompression strip down there, okay, and then that's it, and then they can stand up, and then you'll be right to go. Again, half an hour to an hour before the event, you want to apply this tape down, making sure that the area is dry and it's not going to be wet, so it'll be able to stick down properly. Thanks for watching. If you want any more access to other videos and articles, check out our Aspire Health and Rehabilitation YouTube page. We also have a website, it's www.aspirehealthrehab.com.au, and you can also give us a like on Facebook and Instagram.